In recent years, antibiotic-resistant strains of gram-negative bacteria have been identified as urgent public health threats. Patients who receive delayed appropriate therapy are more likely to have an infection due to antibiotic-resistant pathogens, and patients with infections due to antibiotic-resistant pathogens have also been shown to experience poorer outcomes, compared with patients with infections due to antibiotic-susceptible pathogens. Introducing Zavicefta, a combination of ceftazidime, an anti-pseudomonal cephalosporin, and avibactam, a novel beta-lactamase inhibitor. Ceftazidime avibactam provides broad-spectrum coverage against multiple resistant pathogens. Zavicefta has broad-spectrum coverage against gram-negative pathogens, including in vitro activity against multi-drug-resistant, MDR, Pseudomonas aeruginosa, carbapenem-resistant Enterobacteriaceae, CRE, including KPC and OXA48-producing strains and extended-spectrum beta-lactamase, ESBL, and AMP-C-producing bacteria. It is indicated for infections in adults with complicated intra-abdominal infection, in combination with metronidazole, complicated urinary tract infection, including pyelonephritis, and hospital-acquired pneumonia, including ventilator-associated pneumonia. Let's hear what the experts have to say about Zavicefta.
It's a difficult and treacherous enzyme because the levels of resistance that it gives to carbapenems are often very low. It can easily be missed by the microbiology laboratory. What's more, if an isolate has only got OXA48 and no ESBL, it'll still be susceptible to cephalosporins, particularly to ceftazidime. Several clinical studies have shown that OXA48 producing Enterobacteriaceae are associated with poor outcomes. A couple of studies, 30 to 40 patients each from Spain and in Turkey, 50% mortality in bacteremic patients with OXA48 producers, largely treated with mixtures of carbapenems, aminoglycosides, colistin. We'd need treatments for these infections. And that brings me to the topic of ceftazidime avibactam. Adding avibactam really gives a new lease of life to ceftazidime, which was an old and highly regarded antibiotic. Avibactam overcomes ESBLs and AMP-C enzymes, which are the commonest modes of resistance to ceftazidime. Avibactam also overcomes KPC and OXA48 beta-lactamase.
Well, the importance of coverage, a very wide range of pathogens nowadays is something that it's absolutely critical. Because the epidemiology nowadays is quite complex in many institutions around the world, and there is a clear increase in multi-drug resistant gram-negative, particularly causing pneumonia, causing urinary tract infections or intra-abdominal infections. And at the same point, it's very important to remember that the empirical antibiotic that we provide to our patients is very critical for the outcome of our patients, and of course, multi-drug resistance is decreasing the probability that the drug you are choosing, of course, it will be effective from the very beginning. Ceftazidime avibactam is an active anti-pseudomonal agent with activity against 75% of Pseudomonas species isolated in Greece, Italy, and Spain, including those with multi-drug resistant and extremely drug resistant patterns. The current clinical trials do not capture the real-world cases that benefit from ceftazidime avibactam, but demonstrate that this antibiotic is effective and well tolerated as any other beta-lactams for susceptible microorganisms.
Colistin and polymyxin B is an older antibiotic. We didn't use polymyxin for more than 50 years in medicine. But when CRE appeared, there was no other choice. So polymyxin became the cornerstone, became the backbone to treat CRE before the new antibiotics. But the problem is that polymyxin has significant limitations concerning the safety profile, particularly neurotoxicity and renal toxicity. And recently, many centers have published the increase of resistance. Avibacter is a novel beta-lactam inhibitor that has very good activity against KPC and many OXA48 isolates. It does not have activity against methyl beta-lactamase.